Solano, the Smile Doctor here. Happy St. Patrick's Month. We're here today with Tammy. Thank you, Tammy, for letting us share your video today. So, Tammy, we did a lifting procedure back now in January. So we are a little over almost 5-6 weeks. How's it feeling so far with the lift?
Great.
You look so good. Can we share with them how young you are?
I am 63. Going on 64 this year.
This is not the picture of a 63-year-old. Come take a look at her pictures here. You can see what a nice improvement in her neck and jawline. And through this area, looks very natural. We also did a little bit of lip plumper, not too much, but just enough. Of course, we always look our best when we're smiling. And so she did great from her lift. And today, we're going to be doing a little bit of the filler. We're going to be doing some of the Sculpting and the Bella fill. So, Tammy, what did your family and friends say about your results from the lift?
They thought it was great. Actually, one of my friends is thinking, come here. Another one is coming here.
Very good. Thank you. We'll take great care of them. Okay. And what was it that inspired you to have something done? I'm curious.
I just felt so old. Every time I look in the mirror, everything was sagging down. And I just thought, if I could have a little bit lift. And I just saw you in the villages doing seminars all the time and checked a few things online and thought, this is where I was going.
Very good. And things came out as you expected?
Better.
Better.
Yeah.
We're so happy. Congratulations. So today we're going to do the filler. And just like we talked about, I'd just like to review. Hold this for me here.
Okay.
So we've got our, let's see the little white pencil here. So have a look straight ahead. So we're going to be doing some of the sculpture in the cheek to build in through here. Temple, brow, around the mouth, and she's in good shape. So we got a little bit of hollowing here and through these areas and back of jaw. Same on both sides. Any questions about our goals for today?
No, just in the under eyes too.
And
right?
under the eyes too, that's where I'm going to start with the Sculptra. Okay. Very good. A+ student looking for extra credit. So proud of Tammy. So for the physicians and students that are watching, I like to cleanse with the Hibba Cleanse. I'm going to have you rest your head all the way back for me. So cleansing on the skin. It's very rare that you get an infection from the filler, but we still use the Hibba Cleanse plus alcohol. And my team has everything set up perfectly, makes it very easy. Thank you, Brittany.
You're welcome.
And she's our camera person today. She's going to win a Golden Globe for her camera work in covering our patients, because we're on a mission to stop bad plastic surgery and help people do things the right way.
Brittany, you're the one that answers the phone too.
Say that
No,
again?
you're a different one? Okay.
We got a couple Brittany's
I
here.
was going to say, there's one that answers.
Brittany was so good, we just kept hiring more Brittany. Okay, so I used the buzzer and the lidocaine, so you'll feel buzz, and then pinch on 3, 1, 2, 3, pinch. Pinch, sorry. You feel small, medium, big pinch, not too bad?
Not too bad.
Okay, 1, 2, 3, pinch. 1, 2, 3, pinch. 1, 2, 3, pinch. 1, 2, 3, pinch. Pinch. Tender. Pinch. Okay, let's take a little break there. It's a little tender. Doing okay?
Mm-hmm.
And then a little bit of numbing here. Buzz and pinch. 1, 2, 3, pinch. For the physicians and students that are watching, I like to position myself 1, 2, 3, pinch so that I'm comfortable. 1, 2, 3, pinch. The numbing pinch is so that patients are comfortable. 1, 2, 3, pinch. And once we do the numbing, that's the worst part of it. The rest is a piece of cake. Pinch. Pinch. I've used the numbing creams in the past, but they never numb as good as what just little pinches will do. It's much easier. 1, 2, 3, pinch for the patient. Sorry, a little tender. Okay, let's take a little break there. Okay, now that we've done the numbing medicine, I'm going to start with the Sculptra. Do you feel a pinch here? Not too bad? Small, medium, big?
Small. Very small.
A little pinch. How about over here? Small, medium, big pinch?
Small.
Little pinch here. Turn your head this way a little bit for me. Over here a little pinch. Not too bad. These are the insertion points where I'm going to place the cannula. And turn your head this way a little bit. How about here a little pinch? Not too bad?
Not too bad. I don't know about that one. I don't think I've heard
Thank goodness for lidocaine.
that.
We're on a mission to stop bad plastic surgery, little pinch there, and we're here to help our patients make the best choices. So there's a lot of confusion out there, but if you know what's possible, what your options are, you're going to make your best choices. So with Sculptor, I like to mix it right before I inject. It takes a brief moment to bring the air bubble through the syringe. I'm going to turn your head this way nice and easy. People talk about fillers or fat grafting. We feel that the fillers, the permanent and the Sculptra, the Bellafill and the Sculptra, do a better job than fat grafting, better longevity, and there's no physical downtime with the fillers. I'm going to turn your head this way a little bit. So I use my twist technique to position the cannula in the correct plane. Twist, twist, twist. And then the shiver technique to put a very small amount of filler over a large area. You feel big pinch, little pinch, not too bad. And her eye is going to feel a little bit numb and goofy underneath. Everything's looking good. Thank you for watching and thank you for sharing. So then I use the alcohol swab. I like to cleanse the cannula in between each pass. I've also found when I'm using these cannulas, I put the cannula on tight, but not too tight because then it stays on tight and you can't get it off and you have to get a new cannula for the next one. So you can use this cannula for all of your injections, but I used to crank it on there so tight it wouldn't come off. When you turn your head this way a little bit, it would get a little stretched, but no longer. Pressure pinch, pressure pinch. So she might feel a little pressure pinch, but it's going to feel numb and goofy under the eye. Allergy season is here, so I tell all my filler patients you want to make sure your allergies are optimally controlled because that will make puffiness under the eyes a little bit of an issue. So Claritin, Allegra, Zyrtec, Xyzal, whatever you take, or if your symptoms are significant enough, sorry, a little pinch there, you can go see an allergist. How about now? Do you feel any pinching?
No.
Okay. So she felt that one little spot area, and then now we put some numbing medicine so that will settle for her. Everything's looking good. So we're just putting back the volume that was already there. And I'm going to blend this with under the cheek, because as we age, it's very normal that we lose volume. We lose skin, muscle, fat, but we also lose bone. Thank you for watching. Thank you for sharing. I love hearing our patients. Let me turn your head this way. They've been telling us, you've been watching us for years, and it's an honor that we could be a part of your education in this process for helping people do things the right way. So that hollow area we're going to blend. So twist, twist, twist to advance the cannula into the correct tissue plane. Twist, twist, twist. You might feel a little bit of a pinch. Shiver technique. Small amount of filler over a large area. Tammy, you doing okay, dear?
I'm doing fine.
Everything's looking good. Her face will feel a little numb and goofy, and that numbness lasts about 30 to 60 minutes after we're done. Sorry, a little pinch
I'm
there. Okay,
sorry.
that's okay. How about now? Do you feel a pinch?
Nope.
Okay, we'll go slowly.
It just happens quickly. It's like
It was like
you're
that
not
little, it took her by
expecting
surprise. How about here? Do you feel any pinching?
No.
Okay, now, but what you can see is what a nice difference is building in that area. Are you feeling any pain at all?
No.
Okay, good. That's okay. Take your time. And I'm going slowly. We're not in a hurry, but this way patients can feel comfortable. But you can feel little pinches and then they go away. So rarely I have patients that want Valium, but then you need a driver. Okay, so we're going to go really slow and easy. I'm going to turn your head this way, nice and easy. So I find that little point. It's like a pore in the skin. So we'll go slowly here. A little pressure, a little pinch. Nice and easy. When you go slowly, the lidocaine has time to set in. A little pressure pinch there. Everything's looking good. So you do feel little pinches, but most patients say we're easier than the dentist. Pressure pinch. If you're just now joining, I'm Dr. Rich Castellano, double board certified facial, plastic, and reconstructive surgeon. We're in Tampa and the Villages, Florida. Tammy did about 5 weeks ago her lifting procedure and looks so amazing. Can you show them her pictures one more time there, Brittany? These are her pictures before and after. If you can just scroll through the top to bottom. It's on the up arrow, or yeah. Thank you. So proud of Tammy's results. Looks natural. It's not overdone. Kept her safe. And this will definitely prevent some of her future aging changes. If we're lucky, aging keeps coming for us. So now we're ahead. So I'm using the Sculptor right now. I'll also be using some Belapil and the Zeomin. I like to mix the Sculptor immediately before I inject it. And then I recommend a 5-minute massage 5 times a day for 5 days. I'm going to do just a little bit more here and blend this area through. The Sculptor, you see a result right away, then it goes away. A little pressure pinch. Perfect. We also saw some of our virtual follow-ups today, and we've been doing some fillers. Pressure pinch, pressure pinch. Little pinch there, not too bad?
No.
Are you feeling any pain here? Small pinch there, small, medium, big?
I don't think so. It's just the pressure I feel.
Feels the pressure. Sometimes it just feels a little bit goofy.
Right.
It's looking really good. It may feel goofy, but it looks so good. I'm really happy with what I see. The submalar region really can give us a nice result when you restore that volume that was naturally there. Perfect. Okay. And my team always has things prepared for me. I feel a lot of love in the office every day. My team takes great care of me. They'll take great care of you as well. We also have our IPL specialist here with Caitlin, so make sure you call and find out about that. Because everybody needs their skin treated with sunspots, pigment, and irregular pigmentation. Okay. I'm going to turn your head this way a little bit. Tammy, are you feeling any pain at all?
No.
I'm going to do a little blend. Pressure pinch, pressure pinch. Little pinch, a little bit of numbing medicine. We lose bony volume through the brow, so this is like a little volume brow lift. It's the most natural way to elevate the brow. It doesn't look overdone. Surgical brow lifts have certainly been a little overdone, and I don't even think last that long compared to results you can get with permanent filler. So I mix a little combination of both, Sculptra and the permanent filler. A little pressure pinch, pressure pinch. A little bit of numbing medicine there.
Hey, Iris says, I have cheekbones. Would that make my face look bigger if I had that done?
Well, you choose the areas where you want to treat. You feel a little pinching there?
A little bit.
So the best is you need a consultation to help guide where is right for you to have treatment. So you don't want to overdo the cheekbones, that's for sure. Everyone is different. This is artistry, right? There's no cookie cutter. There's no same way to do it for everyone. Pressure pinch, little pinching, a little bit of numbing. So it is important to have not just a consultation, but a consultation with the right artist. I'm going to turn your head this way a little bit. Very good. So twist, twist, twist to get in the correct location and correct tissue plane. This is subcutaneous. And hydrodissection, once you inject, you press on the area and it helps to spread the product through the subcutaneous space, makes it a little easier for subsequent injections. How's Tammy doing?
We're doing good.
Everything's looking good. You turn your head this way a little bit. Definitely a little bit easier to inject through since I've done a little before. And there's a little numbing medicine. Do you feel a little pinch there?
Just a little.
Everything's looking good.
Again, I don't know if it's a pinch or just like you feel pressure or something.
Right. Now, if you need a break, you let me know.
Okay.
Now turn your head this way a little. A little pinching, a little bit of numbing. A little bit more, then we're done with the sculpture. Then I'm going to use some of the Bellafill. Sculptra is poly-L-lactic acid. It breaks down into lactic acid, which is already naturally found in our body, and it leaves behind the body's own collagen. Bellafill is made up of 80% collagen and 20% PMMA. Let me turn your head this way. The collagen gets absorbed and replaced by our body's own collagen. The PMMA is non-absorbable. That is permanent, and that's why patients want the long-term filler. The most expensive filler is the temporary. We have to keep replacing it. So that's why Bellafill is a popular option. And I like to use the Sculptra because it's a superior collagen stimulator. Let me turn your head this way. And it works very well under the eyes and all around the face. Perfect.
Faye Iris says, how often will that have to be done?
The Bellafill is permanent. The Sculptra lasts 2 to 4 years. With the Bellafill, even with the Bellafill, the body keeps aging. So with continued aging, we can always add a little bit more. But that depends on your standards. That depends on how good of a result you want. That depends on how we age. We go through growth spurts. We go through aging spurts. You feel a little pinch there? Or just pressure?
Just pressure.
Because it's already been numbed when we did the Sculptra, so it's looking really good. Sorry, pinch there. There's a little pinch. Everything's looking good. It's so important to restore the facial volume. We don't think about it, and people are concerned that their faces are going to look too wide, but we won't let that happen. Sorry, a little pinch there. Now, you can see, make a big smile for me, big smile. Looks very natural. Now relax as best you can. So I'm just going to do some massage here. Perfect. And then turn your head this way just a little bit. And turn just a little bit more for me, please. So from the back of the jawline, we'll pressure pinch, twist and twist. Little pinch there, a little numbing. So every time I pass, there's going to be a little bit of numbing that she'll feel there in each of these little spots. How about here, small, medium, big pinch?
Small.
Perfect. It's looking really, really good. You feel a little pressure, a little pinch there. Big deep breath, and I always tell my patients, take a big deep breath. Everybody, if you're watching this video, everybody should take a big deep breath. The injector should take a big deep breath because we forget to breathe sometimes.
Okay, Iris says, does that go into the fat or under the skin?
Subcutaneous, so it's right under the skin, and yes, that is the place where there's some subcutaneous fat. Very good. So the answer is both. Thank you for watching. Thank you for sharing. I'm going to turn your head this way just a little bit. A little bit of numbing, a little bit of the filler. Combination. There's no restrictions afterwards. I like to recommend 5-minute massage 5 times a day for 5 days. You cannot hurt the product. It's a good time to talk about our ABCs of plastic surgery. When you know the ABCs of plastic surgery, you'll make your best decisions because you understand the big picture. So A stands for area. There are 4 areas that we address to improve the facial appearance. If we sag, we tighten. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin, we can polish and repair the skin. Let me turn your head this way a little bit. The 4th area is better than everything else. That's our behavior. Nothing looks as good as Mother Nature's free facelift when we smile. Pressure pinch. And Tammy definitely knows the power of smile. She's a great smiler. And I'm really happy with what I see for her results. So this is the Bellafill we're injecting. We did some of the Sculptra before. How are you feeling, Tammy?
Good.
Tammy's tough. We try and make it easier than going to the dentist's office or easier than getting a tattoo. Perfect. And turn just a little more for me. There you go. That's a pinch there. That's a little bit of numbing medicine as well. Little pinch, little pinch. So the beauty is, even though you may feel some pinches, there's no downtime, and once you immediately when you're done, there's really no pain. Some people might feel a little bit sore. Let me turn your head this way just a little bit. And then I'm going to do some massage. Perfect. I'm also going to strengthen the jawline and inject a little around the mouth. I still like to build the smile lines in through here because we lose the height from the maxillary buttress. We want to pay attention to that. I've done some in the brow and a little bit in the temple. That's good. So minocycline is fine. Thank you. I got some right here. Thank you.
You don't need this?
Correct. Thank you. Great job. Okay. Yeah, let's take a little break. Tell me what you feel. Any tenderness there at all?
No tenderness, no.
Big deep breath. So we do some massage through here and through this area. Now what I'm going to do, when you're ready, I'm going to do a little bit down here through the jawline, so that'll be a little less. Those are some of the sensitive areas. Take your time. And I'm just doing some massage through these areas as well. Are you feeling any pain anywhere?
No.
A little sore or achy? Or your back? Or
I feel thirsty.
thirsty?
Mm-hmm.
Let me, yeah. So can you go grab something to drink? So we're going to give her something to drink here in just a moment. Thank you. I'm going to show her her pictures before while she's getting her something to drink. Now, do you feel lightheaded at all? Because I can set the bed back a little. Let me do that for one moment. So what we do is when there's a bit of the vasovagal response, then we just raise the chair up some. And go ahead and lay all the way back, and you'll feel better laying back. Can you just put a little bit of the drape over top her, please? So the vasovagal response, sometimes the blood flows to the legs. Does that feel better laying back like that?
Yes.
Perfect. So the vasovagal response can be very common, and then I'm going to give you a little something to drink here. And okay, and we're going to raise you up a little bit. Does that feel a little bit better laying back?
Yes.
Yeah, it happens almost instantly. You feel better when you are laying back. And then I'm gonna give you a little bit of the water to drink. Just one moment. Okay, here we go. Here's a little bit of water to drink. Just a little. And it's always good. Sometimes if we're a little dehydrated, you can feel this comes on a little bit more quickly. I'll hold this for you. And I'll give this to you, Brittany. Okay, so does that feel better laying back like that?
It does. I'm
Okay.
not as lightheaded.
Yes. So the lightheaded, when it comes, this is for the physicians and students that are watching, this is the correct treatment. It's called the vasovagal response. We lay patients back. They feel better very quickly, and you can continue this treatment. So now I'm going to contour the jawline. Let me turn your head this way just a little bit. Everything's looking good. Now, do you feel a little bit of pressure?
Nope.
I'm just going to use about a half syringe on each side. And I'm massaging as we're injecting. Everything's looking good. Little pressure pinch. How about here? Do you feel small, medium, big pinch?
I don't feel anything right there.
Okay, perfect. Thank goodness for lidocaine.
Mm-hmm.
But we can still continue the injections. When someone's laying back, sometimes it's even easier to inject certain areas when they're laying back, and I'm going to do some massage. We lose skin, muscle, fat, but we also lose bone as we get older. So now I'm going to turn your head this way nice and easy and turn just a little bit more. Pressure pinch, pressure pinch. How about here? Small, medium, big pinch? Little pinch there. The door quietly. Everything's looking good. You're fine right exactly where you are.
Had to.
Okay, and then just let Quinn and Christina know about the door quietly. Thanks. Perfect, 1 or 2 times. Thank you. Everything's looking good. That's strengthening the jawline. Very small amount of filler over a large area. A little bit more to go, then we're okay.
Okay.
How are you feeling?
Feeling better.
Good, yes, the vasovagal response, this is the right treatment for it. Okay, so I'm going to keep blending in the jawline, but I'm going to do just a little bit here. Turn your head back this way to raise the height for the maxillary buttress here. A little pressure, a little pinch. Pressure pinch, pressure pinch. A little bit of numbing medicine there. The lip will feel numb from this, and that's very normal. Your family and friends will not be able to figure out what you had done, so that's a good thing. And even though a lot of injectors say they don't like to inject in the smile lines, this is a really good place to inject to recreate the normal youthful anatomical proportions. Perfect. And then a little bit down through here. Pressure pinch, little pinch. And I'm guiding with my finger. I can feel that. You feel small, medium, big pinch there?
Small.
Small, okay. Everything's looking good. Very, very proud of Tammy. Super good results. Over here, a little bit of pinching.
A little bit. I think I'm more on guard. If I relax, I'd be much better.
Big deep breath in and out. Okay, how about now? You feeling any pinching?
Nope.
Any pain at all? Any soreness or achiness anywhere?
No.
So the lidocaine does do a good job that once you've injected it and you feel that numbness, you really don't feel much of anything else. And big deep breath. Sometimes we may have the anticipation, is it going to pinch? And when we feel something like that, then we keep our guard up. So take a big deep breath in and out for me.
That's exactly what it is. You're waiting for it.
You're waiting for something. So just go slowly. Pressure pinch, pressure pinch. And it's going to be a little bit numb here. Everything's looking good. Okay, about half the syringe there, and then the other half the remains here. It's very normal that we lose volume in the pre-jowl sulcus, melolabial fold, pressure pinch, little tapping, pressure pinch, little pinching there. Big deep breath in and out, looking really good. And of course the corner of the mouth at that downturn, we're going to fill in that area as well. Thickening the skin. Perfect. Very, very pleased with the results that I see. But as you can see, right, there's no bruise. There's going to be no downtime. A little bit more to go, then we're done. How are you feeling?
Good.
Very good. Super happy with the results. So now what I'm going to do is I'm just going to sit you up a little because I want to take a look. How does that feel sitting up? Does that feel okay to sit up?
Yep.
If you need me to lay you back, I can. Now I want you to just look straight ahead for me. And perfect. Yep. Make a big smile for me, big smile. Now relax as best you can. Yeah, I love the temples, I love the brow. I'm going to do a little bit back on this side here. Just blending a little through here. And a little bit in the cheek. Rest your head all the way back for me. If you feel you need me to lay you back, you let me know, okay? How about here? Do you feel a little pressure pinch?
No.
Thank goodness for lidocaine. Because now that we've numbed a lot of those places, shows very little of what we're doing. Same thing over here. Just balancing out. Everything's looking good. it's very normal in the under the cheek, or we call that submalar, that we're going to get a little bit of hollowing. So that's what we're doing, is we're just putting that volume back where we know it's already been. And then let me turn your head this way a little bit. Turn your head this way to the middle. Perfect. Just a little bit left. Always fussing over the little details. You put the majority of the volume up a little superiorly because that's where you're going to get a little more lift and projection. How about here, a little pressure pinch?
No.
Okay, then we're going to do a little bit of the zoom in. That's for the glabella. So you'll feel buzz and then pinch on 3. 1, 2, 3, pinch. Pinch. Sorry, pinching. 1, 2, 3, pinch. Sorry, pinch. Just take a little breather, big deep breath. Last 2 and then we're done.
Okay.
You're in the home stretch.
Great.
1, 2, 3, pinch. And 1, 2, 3, pinch. Okay, completely done. You did amazing. Now, just to show you what we've done so far, why don't you take a look. Can you see how it builds in that volume?
Oh, yeah.
How does that look?
I like it.
Make a big smile for me, big smile, big smile. It feels goofy to smile, but look how natural her smile looks. Now relax as best you can. Remember, we had those hollows here. The eye, it's very normal for the eye to hollow as we get older. So we did some volume in the brow, some in the temple, back of the jaw, and around the mouth. Now, as we say, you don't want to taste the chocolate cake before it's done baking. The swelling's going to settle. Your homework, 5-minute massage, 5 times a day for 5 days. Jawline, around the mouth, across the cheeks, across the brow, and in the temples. You cannot hurt the product. I like to see you back at 6 or 8 weeks, but if you need me for anything, you give us a call.
Okay.
What questions can I answer?
Just 5 times a day.
5 minutes, 5 times a day for 5 days.
Okay.
This is a good video for you to watch because you can see full face treatment. She had a little vasovagal response, so we laid her back. She feels better very quickly. How are you feeling now?
Feeling good. I'm really happy with this.
Yep. Under the eyes, we get the dark circles and hollows. So then, let me just compare side by side where this was her before her lift. And the hollows you see here, now she doesn't have that hollow so much anymore. We've done the lift, and under the eyes we've made such a nice difference and such a nice improvement, building her jawline. Let me have you turn your head towards me like this, and you can see how much stronger her jawline is here on both sides. Now I'm going to have you turn that direction, and then you look here how the jawline starts to lose its volume, but we've strengthened that quite a bit. So congratulations. I'll see you soon. You did great. Thank you all for watching. We're on a mission to stop bad plastic surgery. Thank you for sharing. We're here to help you raise your standards. We'll see you in the next video. I'm Dr. Rich Castellano.